Bismillahirrahmanirrahim. Assalamu alaikum. Dear students, I am Dr. Asma Saddique, and in general anatomy lectures, we are already covering the general aspects of circulatory system. Moving on to the next part. Before starting today's lecture, just have the revision of the previous one. Here last time you have already seen that we have done with the classification of the arteries. In the arteries, as you have seen, that as descending down from the heart, the arteries, these are changing its diameter, its structural composition, as well as its functional part. As we move down towards the capillary bed, the arteries, they split into the capillaries and they become the exchange vessels. This is at the tissue level. So from the heart till tissue level, the artery is going to change not only its structure but as well as the function of the arteries changing as well. So we are classifying the arteries structurally as well as functionally. In the structural artery, you have seen that there is the large sized or the elastic artery, where the muscular component in the tunica media, that is more in amount, and as well as it is having the elastic tissue because these are closer to the heart and they are going to withstand the higher blood pressures. Then down, when this is at the arteries which are the distributing arteries now, these are the muscular arteries. Here although the muscular amount, the layer of the muscle, that is decreasing as compared to the large size arteries, but these are mostly muscular component in the tunica media. There will be no elastic component. They are purely muscles in the tunica media of these medium sized arteries. So these are also known as the muscular artery. Functionally, the large size artery are known as conducting blood vessels, and these medium size or muscular arteries are known as distributing blood vessels because now these are distributing it towards the tissue. When reaching to the tissue, they split into the arterioles, and here the muscle layer in tunica media, this is decreasing, and even at the terminal arteriole, which is also the met arteriole, there is only single layer of a muscle, or that is a discontinuous muscle layer in the met arterioles. And when these are going to form the blood capillary network, here there is the regulation of the blood flow with the help of precapillary sphincters, which are a cuff of muscle just at the branching site of the terminal arterioles into the capillaries. And these met arterioles and these precapillary sphincters are under vasomotor control or some local chemical control for the regulation of the blood to flow into the capillary network, and then their exchange is possible at the tissue level. Now from here now you can see that these capillaries now they are converging into the new channels which are known as venules. Then these venules are ascend up and they are making up the medium size vein and then the large size vein. So now today we will see the structural composition and function of the capillaries and its classification, as well as the types of veins which are then formed from these capillaries, and also as they are now in ascending order, their structure and functional components, these are also changing. Same as in the arteries, there are these changes in the veins as well. Here I would also like to mention that if you see the lumen of an artery that is very regular, circular in shape, and it is a bit smaller as compared to the lumen of a vein, if you can see, that is a mostly irregular lumen that is present in the vein, as well as these are wider. The lumen is wider in the vein, and the other structure, the differentiating structure in the vein, you can see these pockets of the endothelial lining with collagen tissue. This is a pocket or flaps which are formed. These are the valves which allow the unidirectional flow of the blood in the veins. So these valves are present in the veins as well. So the arteries, these are thick walled as compared to the veins which are thin walled. Here I am starting now from the arteries and arterioles. Now there is the capillary network which is formed, and as you have seen that the capillaries, these are the exchange blood vessels functionally. These are exchange vessels, and this is having only one single layer of endothelium. This single layer of endothelium is wrapped with the basement membrane here. So here this is very thin structure, and that is of very small caliber to allow the passage of the blood at very slow rate, and this is lined up with only single layer of a single layer of the endothelium which is lining its wall. So what is a capillary? I hope you know about it very well now, that the capillary, these are the blood vessels which are exchange blood vessels, and they allow the exchange of the nutrients and wastes between the blood and the tissue cells. And a capillary structurally, that is composed of endothelium, which is a simple squamous epithelium. So the simple squamous epithelium, when it is lining a blood vessel, we label that this is endothelium. So this is just lined by the endothelium, the single layer of endothelium, along with its basement membrane or basal lamina, which is composed of the connective tissue. So here you can see that a capillary that is surrounded peripherally by this connective tissue basal lamina, and on it single layer of endothelium is resting and making the wall of the capillary structurally. So in the capillary there must be the pores which have to be present, and these are the fenestrations which allow the passage of the components, molecules, micro or macro molecules can pass through these fenestrations, or there can be having these tight junctions that their walls are continuous because of the presence of these tight junctions. So we can divide now depending upon these structural changes in the capillary. There are three types of the capillaries. These are the continuous capillaries. So definitely the continuous capillaries must have the tight junctions. This allows specific only micromolecules to pass through them. The fenestrated capillaries, the fenestrations, in a Latin word it is known as the windows. So these windows or pores which are making the filtration pores in the fenestrated capillaries, so allow the rapid absorption and filtration of the molecules. Or these are the sinusoidal capillaries, which you will see are having just the endothelial cells without basement membrane, having irregular shape and can adjust into the tissue where these are present. So these are allowing not only the micro and macro molecules and nutrients, as well as the formed elements of the blood can pass through the sinusoidal capillaries. So one by one we will see the structures and the functions of all these three types of the capillaries. So if you see the types of capillaries, there are three types of the capillaries. So first of all, this is number one, continuous capillaries. Continuous capillaries are the one where the endothelial cells, they are tightly joined together and there are no any pores or no any passage areas are present. These are having the continuous wall with tight junctions without any intercellular clefts or pores, and they are allowing some specific, only the specific solutes or minerals which are going to pass through the continuous capillaries. The location of these capillaries is in the skeletal muscle. Continuous capillaries are present in the lungs and these are present in the brain. So only selective components, they are going to pass through the continuous capillaries. So what are the molecules or the components which can pass through the continuous capillary is mostly the small caliber components. These are especially the glucose. So glucose is mostly required in the brain, in the lung and skeletal muscular tissue for their energy purpose, for metabolic purpose. So only this glucose is going to pass through the continuous capillaries. And very important to know that the proteins and the formed elements of the blood, they cannot pass through the continuous blood vessels. So through the continuous capillary, the formed elements of the blood as well as the protein component, these are not going to pass through it. So here you can see the structure of the continuous capillaries. The capillaries that is going to have the tight junctions that here in this ultrastructural diagram you can see very easily that the single cell that is going to be closed at here through this tight junction. So there is a tight junction and the wall of capillary is continuous. There is no any pore, no any cleft or slits you can appreciate. So this is having the continuous wall that is a continuous capillary. This very important structure that is lining along peripherally the capillary wall, that is a muscle-like structure known as pericyte. So this is having one single layer of the endothelium along with that pericyte which is present along the blood capillary. So here you can see that this one, they are showing the continuous caliber. So I have already told you that these are present in the skeletal muscle, in the lungs and in the brain. So the next type, the second type of the capillaries are the fenestrated capillaries, which by name is very well explanatory that they are having the fenestrations or pores. So the structure of fenestrated capillary, that they are having the pores on the endothelial cells and they are just giving the appearance of a sieve-like presentation. Here you can see that this is giving you the appearance of a sieve-like appearance. What is a sieve? You know, in Urdu हम इसको कहते हैं छाननी की तरह. तो ये छाननी की तरह की देखें आपको यहाँ पर पिक्चर नज़र आ रही है. So just like a छाननी, the sieve-like appearance you can appreciate, this is because of the presence of pores or fenestrations. These pores are known as filtration pores. So from here some important molecules can filter through it, which cannot be possible in continuous capillaries where only we have seen the glucose is going to pass. But here in these fenestrated capillaries, due to these filtration pores, some very important molecules can also pass through these pores. So these are the fenestrated vessels. So these filtration pores are very thin, glycoprotein layered, and they allow the passage of the molecules. These are mostly present where we require the rapid absorption or filtration. Definitely these pores are very helpful for that absorption. So these are present in the endocrine glands from where we need the absorption of hormones. For the filtration in the kidneys, that is very important organ for the filtration of very important components and molecules and water. So in the kidneys as well as in the small intestine, we are mostly see the fenestrated type of the capillaries for exchange at the tissue level. So here this is showing you the structure that here you can see, you can appreciate, very important, that pores which are present and slits, and here you can see also the pores and slits. These are present in the endothelial lining of the capillary wall, and these are the filtration pores or fenestrations. And these filtrations pores, they are having and separated with the intercellular clefts. So in between these pores, the areas is the intercellular clefts through which the absorption or filtration is possible. So look at this picture again. You can see these areas here which are showing you the filtration pores, and these are the fenestrations. So because of this, they show you the sieve-like appearance in the capillary wall. So these filtration pores, they are having these fenestrations for the rapid absorption, and here at that area where this is joining, this is showing you that intercellular clefts. These are intercellular clefts, you can appreciate here. So this is the structure of a fenestrated capillary. Again, I would like to revise that these are present in the small intestine, these are present in the kidneys, and in the endocrine glands. So the next, third and last classification, the type of the capillaries are the sinusoids or discontinuous capillaries. These are the sinusoidal capillaries, which are also known as discontinuous capillaries. So here in the endothelial wall, there is wide gaps which are present, and only these are having the endothelial cell which is not supported by basal lamina or basement membrane. So there is absent basal lamina in the sinusoidal capillaries, and only the endothelial cells are separated by the wide gaps. So these gaps, again, you can understand here now the large macromolecules, even every type of the molecules and components can pass through these sinusoidal capillaries. So as there is not basement membrane, so the cell, the endothelial cell that attain the shape of the surrounding tissue where it is present, it is going to adjust itself in the areas. So here there is having very irregular shape which is adjustable into the structure where it is present, and the molecules which can pass through them is the proteins, the blood cells as well, which are the formed elements. So these can also pass through these wide gaps which are present in the sinusoidal capillaries. So mostly these are present in the liver, definitely, where all the metabolic components, the nutrients from the GIT has to enter into the metabolic machinery. Then is in the bone marrow, in the spleen, that is the lymphoid organ. So lymphatic, all lymphoid organs, they are having these sinusoidal capillaries. So just have the now structure here. You can see here are very wide gaps which are present in the sinusoidal capillaries, and that is having just very incomplete or absent basal lamina. So here macromolecules and these formed elements can also absorb and pass through these gaps. So mostly I have told you this is in the lymphoid organs like lymph node, spleen, in the bone marrow, and here in the liver. This is a structure of a liver. You can see these are the hepatocytes, the cords of hepatocytes, and in between this vessel which is going to adjust and present in between the area and the area and place which is present in between the cords of hepatocytes. So this is very adjustable, irregular in shape, very thin walled, and that is now known as hepatic sinusoids. So in the liver, these are hepatic sinusoids. So in these hepatic sinusoids, the nutrients, these are going to pass through absorbed into the hepatocytes, which are the liver cells, and then they undergo and enter into the metabolic processes. So these are known as the sinusoids, which are also known as discontinuous capillaries. So I hope you understand it. So we have done with the arteries ending up into the capillaries. Now these capillaries, they converge and joined together at the ends, and then these are making up the venules, which are the venous end of the blood vessels. So from the arteries, all the deoxygenated blood and all the nutrients, these are going to absorbed and exchanged through the capillaries, and then from here the waste material, that is also absorbed and transported back into the blood through these veins. So the capillaries are going to converge into the venules, and then these venules are making up now all the venous system in the blood vascular network. So when veins are formed, these are also composed of three tunicas, which we have already seen in the arteries. The tunica adventitia or tunica externa, that is making up the outer layer. Then this is making up the medium or in middle one, tunica media, and the innermost endothelial lining, that is making up the tunica intima or tunica interna. And this is consisting of all these three tunics, which are making the structure of a vein. The tunica externa, which is the tunica adventitia, that is consisting of the collagen fibers and the elastic fibers, and these are mainly, and this is going to be more thickened in the veins as compared to the arteries. So that is having more collagenous fiber in the tunica adventitia. Because these are the capacitance vessels and reservoir vessels, they have to expand and they allow the pulling up of the venous blood into the veins. So because of these collagenous tissue, they are making it expandable. They are more expanding and expansile to pull up and making our blood reservoirs. So functionally we label these veins as the capacitance vessels or reservoir vessels. So I am telling you the structural classification along with the functional classification together. So you must remember that the veins which are now functionally classified into the capacitance. So the veins, same as the arteries, these are also divided starting from the venules. Now we are going from distal to the proximal side. These are now becoming the medium sized veins and large sized vein. So from the venules, these are going to become more larger and known as medium sized vein, and then when their caliber is increased, then they are going to become the large sized veins. So they are also having all three structural organization of the tunica intima, tunica media, and tunica adventitia. So again here, the classification of the veins or the types of the veins, again functionally we are classifying it into the capacitance or reservoir vessels. So here you can see in this picture that these are starting up as a venule. So the venules which are just closer to the capillaries, these are post capillary venules. The post capillary venules are going to have only and only tunica intima in its outer wall. So these are having the tunica intima, which is just the single layer of the endothelium with very few amount of the collagen tissue which is supporting it outside. So they receive the blood from the capillaries, and then these are going to have very porous structure. They are more porous as compared to the capillaries. So there are mostly the venous sinusoids. These are most prominently seen in the body. From here, the exchange of waste material and waste component, that is going to rapidly absorb. So that is possible at this post capillary venules. When in the tunica media, the muscular component, 1 to 2 layers of smooth muscles appeared, then these are going to become the muscular venules, which are the from post capillary venules. The next one, when there is the appearance of smooth muscles in the tunica media, but they are just having 1 to 2 layers, these are muscular venules. These venules are joining together and going to form small veins. The small veins in the body, these are very numerous and very small in size. These are going to be present, making the networks. So we are going to see mostly these are unnamed veins in the body. So many unnamed veins, these are the veins which are small sized vein. Next to that, the larger vein, that is the medium sized vein. Now here in the tunica media, the smooth muscle layer is increasing in its layers. So this is the medium sized veins. We are now see these veins which are named veins, and we are especially seen in the superficial veins as the cephalic vein, the basalic vein, and the saphenous veins in the lower limb. So they are having many venous valves. So definitely in these veins, as the flow of the blood, that is anti-gravity, as well as it is in reverse order, moving from the distal to the proximal side towards the heart. To prevent its backflow, we need to have these venous valves. So venous valves allow only unidirectional flow of the blood. When the muscular component in these tunica media is increasing, then these are becoming large veins. The large veins are having more diameter, their lumen is wider, and these are making up the larger veins in the body, which are the venae cavae, the superior inferior vena cava, the pulmonary veins, the jugular veins. These are of large caliber, and these are labeled in large veins. There are also certain type of the veins which are venous sinuses. These venous sinuses, here especially, the veins have very thin walls and their lumen is very larger. In its tunica media, there is no smooth muscle is present. So these are large size veins with very thin walls but absent smooth muscles in tunica media. These are, you can see in the coronary sinus of the heart and the dural venous sinuses in the brain. And to reinforce it, I am showing you the picture here. Here you can see in this groove, which is a atrioventricular groove on the base of the heart, this is the coronary venous sinus, which accept and which has the tributaries from the all the veins from the heart. So it is draining all the venous blood of the heart into the atrium, into the right atrium. So this is coronary venous sinus. And here in the brain, these in the dura mater, in the dural folds, you can see these sinuses which are present. These are the dural venous sinuses. So these sinuses, as I have told you, these are thin walled. They are having no any muscle in the tunica media. And here this is the one which is a larger dural venous sinus here present, which is the cavernous sinus. That is, here you can see the cavernous sinus. So these are the venous sinuses. So here to show you the structural differentiation between an artery and a vein. As in a vein, you can already see that this is having wider but irregular lumen. So a vein is having wider and irregular lumen. Their diameter is more, and their tunica media is not as thick as that of the artery. Compare it here, that the tunica media in an artery, this is a muscular artery. So here in the tunica media, there will be more and more smooth muscles. These are up to 40 layers of the smooth muscles. But the tunica media in a vein, that is not as much. It has only up till 20 to 25 layers in the larger vein. So this one is the tunica media of an artery, and you can compare this tunica media, which is thick in artery, but this is structurally not as thick in the vein. But if you see the tunica adventitia, that tunica adventitia, that is more thickened in the vein as compared to the artery. And here we need that tunica adventitia to be thick because the veins are the reservoir and they have to pull up the venous blood. So they act as a reservoir or capacitance blood vessels. So I hope you can very easily and clearly understand the structural differences in an artery and in a vein. So here, a very important function the veins are performing, that is the venous return. So definitely the veins are going to provide the channels which are helping in the venous return from the tissue level. This is carrying deoxygenated blood towards the heart. So this is known as venous return. So the very important factors which are helping in the venous return is definitely the skeletal muscles. So the deep veins, which are mostly you can say is the medium veins. In these medium sized veins, there is the skeletal muscles which are surrounding them. Their contraction that is going to helping to increase the venous return. So the contraction of the smooth muscle that puts pressure and compresses the vein, and then this is helping into the increase in the venous return. Number 2 are the valves. These valves which are helping in the unidirectional flow. So when we have to push and send up the blood towards the heart to improve the venous return, these valves has to open. So when the muscles are contracting, these are pushing, they are exerting pressure on the veins and then increasing the venous return, then these valves are open, and the valves which are located now distally, these are going to close. And if now these valves are closing, definitely these are preventing backflow and then pulling of the blood. So backflow is prevented because of the contracted and closed valves, and then the proximal valves, these are open up because of the contraction of smooth muscles and its compression that is improving the venous return. That is also the very important factor, as you have seen, the lactic acid accumulation in these muscles. This is leading to the pain. And when we are compressing the muscle manually, then these are improving the venous return and releasing their lactic acid into the venous blood. So when these are going to exchange and remove its lactic acid into the veins, then definitely there is also the relief in the pain. So that's how you can see in old age the grandmothers and fathers, they requesting you to please compress my calf muscles. So because they are getting the pain due to accumulation of lactic acid in the muscles. So these are going to be relieved because of compression, because they are increasing the venous return, and as well as these are releasing their. So now here I end up all the classification of the arteries, capillaries, as well as the veins. So basically you have seen that the structurally we are classifying the arteries into the elastic artery, which is the large size arteries. Functionally these are known as conducting blood vessels. Next, the muscular arteries are the medium arteries, which are distributing blood vessels functionally. Then are the arterioles. Here these are the arterioles that are the small size arterioles. These are, now you can say, are the resistance blood vessels, because at these arterioles and metaarterioles, these are having some resistance for passage of the blood due to precapillary sphincters. Then the capillaries, which are the continuous fenestrated capillary, as well as these are the sinusoidal capillaries, which are very porous, and these are the exchange blood vessels functionally. Then these converge into the venules, and these venules are now moving on, making up the medium sized venules and large sized venules, more moving towards the larger veins closer to the heart, the vena cavas and all these pulmonary trunk and the jugular veins. These are the large sized veins, and not only their structural composition is changing, these are basically functionally these are known as the reservoir or capacitance blood vessels. So these venous end is the reservoir or capacitance blood vessels. So here summing up all the classification and types of the blood vessels. So now here I end up of today's lecture. Thank you very much. I hope you understand it very well. If there is any query, please feel free to contact me. Okay ji, Allah Hafiz. Thank you very much.